So there are various types of information that can be useful for medical doctors to diagnose a patient. Some of those may be partly available in the type of data that they acquire on patients, but only partly. For example, in medical imaging, they see motion of the heart, but actually it's only partial because even point-wise displacements are not seen in even MRI images of the heart. And of course other information are not available directly in images, so that one way to proceed to combine mathematical modeling and direct data acquisition for medicine is to actually use the model to recover some part of information that is missing. So for example, the map, the cartography of detailed displacements over the heart, hence the deformations, but it can be also used to obtain maps of different quantities that have never been measured, acquired in patients. For example, stresses within the tissues, that is internal forces, or material parameters that, for example, the stiffness of the tissue that cannot be measured in vivo and that have to be extracted from the model when comparing model simulations with actual measurements. Well, first of all, I'd like to emphasize that there is no such thing as a perfect weather forecast. You know this in practice with the weather. So it's true for modeling in medicine as well. And here, the key is to understand the type of modeling and the degree of precision, of accuracy that is needed for a specific application, for a specific medical application. So first of all, you need to circumscribe the system that you're looking at. So it could be either the heart or only a part of the heart, or conversely the whole cardiovascular system, or the cardiovascular system coupled with the lungs. So there are many boundaries that you can put on the system, and then within each part you can look at different types of behavior, and for each of them try and solve some model equations. So the first thing is to circumscribe the model to the application. And then, when this is carefully done, so selecting the model, the system and the model, then you can play this game of pushing your accuracy to the required value. So I cannot give an absolute answer to this question. Okay, so here the type of specific applications that we've been looking at was a therapeutic strategy that's called cardiac resynchronization therapy, CRT. Patients indicated for this therapy have a desynchronized activation of the cardiac contraction. That means some parts of the heart, of the cardiac tissue, are actually triggered a rather long time before other parts. And the CRT, the therapy, consists in using pacemaker with several electrodes to actually try and resynchronize the triggering of the cardiac contraction. And here, the problem in practice is that it can be assessed that more than half, maybe 2/3 of the patients who receive this therapy do not show any benefit from the therapy. So there's a risk, there's a cost involved, and no benefit for at least half, if not 2/3 of the patients. And here, the model, when it's tailored to the patients, can actually predict how the patient will respond to the therapy. So you can at least eliminate non-responding patients, not treat them this way, find another way to treat them. Or better, optimize the treatment, tailor the treatment to the patient. So this, we have performed a proof of concept on a few patients in the early 2010s. And then there were an additional extension with trials that we could call preclinical trial made in a large European collaborative project called VP2HF with many partners, including of course the St. Thomas Hospital. And now it could come now and with the same success. So now it's ready to be taken by applications, but of course this will require now extensive clinical trials on many patients.